Yes, sir, it's visible.
Okay,
Yeah, it is
so
visible.
okay, good. So OET is an English test that is for healthcare professionals. Not everybody can sit for it. Just like IELTS, in IELTS everybody can go and sit for it, but in OET only healthcare professionals can attend it. And different healthcare regulatory bodies accept it, and it actually assess your communication skills. And then we have some subtests for it, as I can assume that most of you already know it. So if anybody has question regarding OET, please ask me right now. Then I have some questions in written form, then I'll answer them.
Sir, I want to ask one question. As I'm preparing for 23rd of July, so here I'm because I have the understanding what is OET, so I am looking for some tips to enhance our score.
Okay, well, that is a very good question. But can you please let me know which subtest exactly are you talking about? Do you talk about OET in general, or do you face difficulty with either maybe with listening or maybe with reading?
So sometimes if I talk about listening, especially part three, part C, and reading part C and B also. So usually I get 30 in between the range of 32 to 36. But sometime because in last two tests I've just got 30 only, so I'm a bit afraid whether I'll be able to clear it or not.
Okay. Okay, well, for OET, if a person can get somewhere like from 28 to 32, it is considered a good score. If you get like 36, that is an outstanding score. Now, coming to your queries regarding listening part C and reading part B and C as well. First of all, let's talk about uh, listening part C. In part C, you always need good skills of listening. You need to be very attentive. You need to be an active listener, and also you need to notice down the keywords in your question. That will really be helpful when you listen to the conversation. I'll just show it to you. I'll just show you some part of listening part C, and we can talk about it clearly.
Thank you, sir.
You're welcome. Okay, I hope you guys can see my screen. For this one, the previous screen was visible, but I'm not sure about this one. I hope you guys can see it.
Yes, sir, we can see that.
Okay, just move to part C. Okay, in part C, it's very important that we note the keywords in our questions. Like when you are given 90 seconds for reading your questions, right? In that time, you need to underline the keywords in your questions, as well as you can do that in the options as well. For example, if you can see this, let me zoom it a little bit. If you see question number 37, it says, Anna says that the main focus of her work as an occupational therapist is. Now, you know, you can see which is the keyword in this question. That is the main focus of her work. Yes, you can underline it, right? When you underline it, you also can go to your options in that time, and you need to do it quickly, right? You'll only have 90 seconds. Then you can go to your options as well. Designing activities. Okay, designing activities is your keyword. Making sure she supports patients in reaching their goals. Support patients is your keyword. Being flexible enough to deal with patients of all ages. Deal with patients. This is your keyword in this one. Now, maybe in the conversation, they will speak about all these things, right? But some of them will be kind of rejected. Maybe the speaker will not agree with some of them. Maybe they will say that my job is not to deal with patients. So then you cannot choose the C options, right? Sometimes we make this mistake that if we hear something in the conversation and we see it in our on our paper, we think that that is the correct options. But it is important that we listen to it clearly and completely in order to understand if they go against that option or they actually agree with that option. So in this regard, you definitely need keywords to be underlined and focus on them. Do you actually follow this strategy, like underlining the keywords and then listening for it? I'm not sure which person was speaking, but if you are following this strategy, it's all right. If you are not following it, then I would recommend you to give it a go. Once you try it, you'll find it really easy. Like sometimes, this conversation is continuous conversation, and they don't wait for us. Like in part B, they actually wait for us to read the question, then they speak, and then they give us time to choose an option. But in part C, it's totally different. You will listen to a continuous dialogue or monologue. So for that reason, you need to underline the keywords in your question as well as in your options in order to actually focus in what the speaker say. If you look at question number 38, when Anna first met the patient called Ted, she was, in this question, you cannot actually, find out the keyword. If you choose met the patient, that's all right, but still, you'll be a little bit confused. So for this question, your keywords are very important in your options, right? So unable to identify, this is your keyword. Optimistic that he would regain full mobility. Regain full mobility is a keyword in this option. Mainly concerned about his state of mind. Then you can say concerned and state of mind. Both can be keywords, but you can underline either of them and then actually listen to the conversation very attentively and actually focus on these words. Maybe synonyms for these words. You can focus on them. And these keywords will make you an active listener in order to focus on these words, and you will not lose your concentration as well.
Thank you, sir. Thank you so much for explaining this for me. Thank you so much.
So have you been following this strategy, or were you doing it through a different way?
Sir, what currently I'm doing, I am underlining the keywords of questions, not the options, which is mentioned here. So I'll surely give it a try. So from now onwards, I'll surely do what you have recommended.
Yeah, just try it maybe once or twice and you will find it extremely easy. Yeah, listening part C is always difficult. I don't say that it will be just a piece of cake for you. No, I don't say that, but it will make a difference. And you definitely need a lot of practice. You know that already.
Yes, sir. I can understand that lots of practice is required. And actually, there is very limited OET material is available on internet.
Well, yeah, that is absolutely right. Unlike IELTS, for IELTS you can have a lot of materials, and for OET maybe
That's true.
you'll have maybe not even 10 subtests, which will
Yes, sir. Very limited.
yeah, sometimes we have that difficulty. But again, for listening, I would also like to suggest to you that you can go to YouTube and listen to health related podcasts, and that will help you develop your strategy for listening, and that will make you a little more attentive. So you can also use that, and that will really help. And if you can do tests like 10 to 15 tests for OET, and you can manage to get a score of 30 to 32 or maybe above that, then you are absolutely ready for it. The real OET is easier compared to what we see in our practice tests.
Sir, here I am so sorry. I'm become greedy now. I want to ask one more question. In OET, sir, is it's a definitely a 1 marks question. It's coming. I'm sorry. What I'm trying to ask that every question is 1 marks question, or there is a variation is available.
Well, uh,
Means
well, that is a good. Well, let me answer your question. That is a good question, and it was also asked by a candidate who had filled our form. You know, in listening, if you look at it, you have total of 42 questions, right? In the part A, you have
40 subjects.
24 questions in part A. Then you have 6 questions in part B, and then you have 12 questions in part C. Each question has 1 mark. For example, if you manage to get 22 or maybe 20, or some people can get more than 22, then you'll have 20 marks in part A. And if you manage to get like 4 marks in part B, you'll have total of 26 marks. 22 in part A, 4 in part B. Then you would require only 4 marks in part C in order to pass your listening test. The same applies for reading. Each question has 1 mark.
Okay, sir. So it means if I'm scoring 30, so it means I'm ready for a OET, then I'll be able to clear it.
Well, everybody knows themselves better than anybody else, but I just told you what an average person would get and how would they feel that they are ready. If a person gets like, maybe I said 30, if a person gets in practice 28 to 32 in between them, between these scores, then I think they are perfectly ready for OET, because the real OET is easier compared to what we see in our practice.
Thank you, sir. Thank you so much.
You're welcome. So you had also asked a question regarding reading part C and part B. Let me answer that quickly.
Please do that.
I'll show you the screen as well. I hope it is visible to you.
Yes, sir, it is.
Okay, and reading part B, you'll have 6 questions, and each question has a text with it, or I should say a small paragraph with it, right? So what you need to do is, you don't need to read the paragraph first, right? You need to read the question. If you look at this question, it says the memo reminds all staff to avoid. Then you have these options. Well, I always suggest that you don't read these options first. What you need to do is read the question and then go to the text, and then read the text very attentively, and pay attention to every single point on it, and then find answer to the question by yourself without reading the options. And once you find answer to this question, then come to your options and compare your answer to these options, and then you will whatever matches with your answer, then you can choose that, and that is most probably would be the correct option. I hope part B is now a little bit clear, and I hope I answered your question.
Yes, sir. I'm currently doing that only. That first I'm reading a question and try to understand that question, and then I'll go to a text, and by reading thoroughly, I'm just jumping to the options which is available. But sometimes I get confused. What is gist? What is detail?
Well, you don't need to jump to your options right away. What I said is find answer to this question in the text by yourself without reading the options. Once you find answer to it, then come to the option and compare your answer with these options. And then you realize whatever matches with your answer would be the correct one. And comparatively, I think part B is the easiest part, I would say. Sometimes for some people it's difficult, but if this strategy is followed, you have the text in front of you. It's not like listening that something once you hear and it goes, you will never hear it again. You have the text in front of you. You can even compare the options with your text. You can come here, compare the first option A with your text. If it does not match, just exclude it. Come to the next one, compare option B with your text. If it does not match, then you definitely have only one option left, and that would be the correct one. So you can follow different strategies, but I always recommend that find answer to the question in the text by yourself, and then come to the options, compare your answer with these options, and once you find if any of them matches with your answer, then you can choose it. I hope it is a little bit clear for you now.
Yes, sir. Yes, sir. And
And
sir,
what is
can we manage a time? Because time is also, because just in 45 minutes, we have to complete both the parts. And part C, there is a two extract which we need to complete, and they are very lengthier one. So,
yeah.
can you suggest something? How can we manage a time?
Yeah, sure. Well, let's go to part C. Now, I hope it is clear. And part B, if you follow this strategy, you can do it like maybe in 10 to 12 minutes. The rest of the time will be for your part C, in which you'll face two lengthy texts. And I understand, not text, but they're a combination of paragraphs. So that's extremely difficult in the beginning. But one thing is, you don't need to read the whole text, all these paragraphs in the beginning. What you need to do is go straight to your questions. Go to your questions. As you can see, this one, it's a very lengthy text, and we have the questions here. Now, it says the first paragraph explains that stress. So in this situation, what you need to do is don't read your options. Go to the first paragraph and find out what it says regarding stress, and find answer to this question by yourself. What does it explain regarding the stress? And we call these questions like statement type of question. If you remember, or if you know, in reading part C, we have 4 types of questions. One is statement type of questions, one is normal question, one is referral question, and one is
Lexical question.
lexical question, right? So this one is more like a statement type of question. What you need to do is, for this question, you need to understand the whole message of first paragraph, right? That what does it explain regarding stress? And once you find that, once you get the idea of that paragraph, that what it says regarding stress, then you can come to your options, and you can compare your answers with these options. And once you find that, for example, in this situation, you said that part B matches with your answer, then you can again go to the text and compare this option with the text and find that if it really matches. And once you are sure regarding it, then you can choose it. And you can also do another strategy, that is exclusion. You need to exclude this question. For example, you say you compare option A with your paragraph, and you say, no, it does not match. Then you can come to B. You say, okay, it matches a little bit. Then you say, let's do part C, option C. You match it with your paragraph. It does not match. Then do option D and you compare it. It does not match either. Then you definitely have the last option, that is option B, and you can definitely go for it. So that is what the strategy should be, and that is how it is done. And don't worry about the time. The only difficulty most people have is when they do part A. That is more challenging. For part B and C, it is really easy to do it in 45 minutes. Yeah, in practice, you may struggle with it. But real OET, as I always say, it's easier compared to what we have in practice. So you will be easily able to do it in 45 minutes. I hope it is somewhat clear for you now.
Yes, sir. Yes. And sir, how much time should we spend in each question, especially
Well,
in part?
you are talking about part C?
Yes, sir. Yes, part C.
Well, it totally depends on how quickly you do part B, right? For example, if you manage to do part B in 10 minutes, you'll have 35 minutes left. Now, in reading in part C, you have 16 questions. Now, it's a simple division. You can do that, and you need 2 minutes for each question. So it's when we talk about it like this, it seems a little bit difficult that how come you can do it in 2 minutes. But once you do it, once you start doing it, you can do it in less than 2 minutes if you follow the strategy. For example, if you look at question number 9 on the screen, this is called lexical question. Most people don't know what strategy should be used for it. They go to the paragraph and read the whole paragraph. But for this kind of question, it is recommended that you find this word in the paragraph and then read one sentence before this word and one sentence after this word, and you can find answer for this question in those 2 to 3 sentences. So you will save a lot of time for yourself to solve the next question. So these strategies should be followed for it, and you need maybe 2 minutes and 30 seconds for each question. That is how much time you'll have. But if you spend like 15 minutes for doing part B, then you'll have only 30 minutes left for doing all these 16 questions. Then you'll have less than 1 minute, less than 2 minutes, right? So that is how it should be done.
So it means if we practice more, so it will enhance our chance to clear it, right?
Well,
So we have to
absolutely.
practice.
Absolutely. It depends on your practice. If you do it over and over and you keep doing it, try to do it as quickly as possible. Forget if you, in practice, forget if you answer something wrong. Just try to do it quickly. Try to do it quickly. And once you, for example, you did it quickly and the answer was wrong, then come to your options and again to the text and find out why you answered that question wrong. Was it the time that was less, that was too little for you to answer the question correctly, or was it that you followed the strategy in a wrong way? Was it that you focused on the wrong portion of the paragraph? Find reason to that, to that question that you answered wrong. Then you can manage it. So try to do it as quickly as possible in your practice, regardless of thinking of you will do it wrong. But it totally depends on your practice. If you do it more, you'll become better.
Thank you, sir. Thank you so much for making us understand this para very good, in a very good way. So thank you so much. And sir, how many, for example, as I'm planning to give exam of 23rd of July. So what you recommend means how many tests should I practice daily?
Well, it depends on your score. For example, some people cannot manage to get 30, they get like maybe 24 and 25. Then we recommend that they should practice more. But if you manage to get over 30, then you need to just keep this temperament. So for that, you can just do one test from each subtest, right, on daily basis. So that will be perfect. But if your time permits you, you can do more. It's always better. But one test is mandatory. Just don't skip even a single day till your test. If you, for example, skip 2 to 3 days, then everything will be totally new for you. So try not to skip even a single day.
Okay, sir. Okay, I'll do that. Thank you.
Thank you. Okay, somebody has raised hand. If they want to ask a question, they can. Okay, you can ask questions, please. We have Sarwan. Sarwan has raised hand. If you want to ask any question, please do. Okay, this person has asked a question in the chat section saying that how can we make plan for OET practice? Well, plan is always in your hand, but I would recommend you to start it from right now. Don't wait that I'll do it tomorrow, I'll do it after tomorrow. No. If you keep on doing that, if you keep on rescheduling your practice, then you will never do it. Try to start it from right now, and you can do, you can give it like 2 to 3 hours on daily basis. And if you can do one test from each subtest on daily basis, that is perfect. And you'll realize with time that your score is increasing. Okay, another person has asked that I have OET in 2 weeks. Can I get prepared for it? I have not started it yet. Oh, okay. You have already booked OET, but you have not started preparation. Well, yeah, you can absolutely get ready for it in 2 weeks, but you definitely need a lot of practice and dedication. In general, I'll give you an overview regarding OET. If you don't have any idea, in OET we have 4 subtests. In OET we have 4 subtests, right? I'll show you. I have already answered this question, what is OET? I told you about it, and now coming to the overview that this person needed for it. Which countries accept OET? You can see it on your screen. And what score we need for it. Okay, this is an overview for this person who said that he or she has a test in 2 weeks. Okay, in OET we have grades. In IELTS we have bands, but in OET we have grades. We have grades from A to E. If you get score, like you in listening, you have total of 42 questions. In reading, you have total of 42 questions, and you need to get 30 in order to get B grade. If you get 30, your score will be 350. That is B grade. And so is for writing. In writing, then we have scoring criteria for paragraphs in a different way, right? And then for speaking as well, for speaking, we have a different criteria. If you go into the detail of that, that will be, it will require a lot of time, but let me just give you an overview in general so that you have a little bit of idea. Okay, and which professionals can sit for it? All these professions that you can see on your screen: nursing, medicine, pharmacy, radiography, physiotherapy, speech pathology, all these people can sit for it. Then OET, we have 4 subtests: listening, reading, writing, and speaking, right? OET in listening, listening and reading are same for all profession. Whether you're a nurse, you're a doctor, you're a physiotherapist, or any other professional, you will all have the same listening and reading test on that day. Writing and speaking are specific to your profession. If you're a nurse, you'll be given contents related to your profession for writing and speaking. And if you're a doctor, it will be related to that. If you're any other professional, it will be related to that profession. Now, in listening, we have three parts, A, B, and C. Part A has 2 extracts, total of 12 questions, and these questions are called blank type of questions. In part B, we have 6 questions, and these 6 questions are multiple choice questions. And in part C, we have 6 questions, but we have 2 extracts. So in total, we have 12 questions, and they are also multiple choice questions. But in this one, it's a little bit difficult. You'll listen to a continuous conversation. You will not be given time after each questions to read it and then answer it. No, you'll just read it in the beginning, in the first 90 seconds, and then once they start the conversation, maybe it will be a dialogue or monologue, then you'll continuously listen and answer your question, listen and answer. So you'll be kind of doing 3 tasks at the same time. You listen, read your question, and answer it. So you'll be doing 3 things at the same time. Reading. In reading, we also have 3 parts. A, B, and C will have total of 1 hour. In part A, we have 20 questions and 4 small paragraphs or texts. And you'll have 15 minutes for reading all these texts and also answering all these 20 questions. So that is why it is a little bit challenging. It needs a good strategy. And for that, I would recommend you to join our course. We will guide you in every step. How and what strategies should be followed in order to read all these texts and also answer all the questions correctly in 15 minutes. Now coming to part B. In part B, for part B and C, collectively we have 45 minutes. Part B has 6 questions. Each question needs to be answered from a small paragraph given with each question. There will be 3 options, and the one you think is correct needs to be chosen. So I have already talked about reading part B and C with that person, so you have some idea about it. Part C has 2 extracts, each containing 8 questions. 2 lengthy texts will be given. Multiple paragraphs will be given containing roughly about 800 words, and each question has 4 options, and you must choose the one you think is correct. Now coming to writing, you'll be asked to write letter. 3 types of letter we have in OET. Referral letter 99% of the time. Then we have discharge letter, transfer letter, and each letter has different format. I mean, you cannot follow the format of transfer letter for discharge letter. And each of them has a different format. What paragraph should be written at what area? What should you write in the first paragraph? What should you write in the second paragraph for all these types of letters? So that you will also be guided regarding it in our full course. For writing, you'll be given case notes regarding the patient, and a task will be given at the end of your case notes, and you will be required to write 180 to 200 words, and the total time you'll have for it is 45 minutes. Now coming to speaking, you'll be actually performing 2 role plays. You'll have total of 20 minutes for these role plays, and those 20 minutes, the first 3 minutes are for warm-up question, 3 minutes for reading each role play card and preparation, 5 minutes for each role play. The actual role play that you'll perform is for 5 minutes. And then again, once you finish the first role play, again, you'll be given another role play card, and you'll then you'll read it for 3 minutes. And again, you'll actually doing your role play for 5 minutes. And what they actually do in speaking, your clinical and linguistic skills are assessed. Linguistic skills has further 4 parts and scored on a scale of 0 to 6. Clinical skills have 5 parts and are scored on a scale of 0 to 3. I hope I have cleared it for that person who had no idea regarding OET, and they have the test in 2 weeks. I hope they got a little bit of idea. It was not in detail, but still superficially I gave them some idea. And also this person has asked that what type of questions we have in part B and C, please explain. Well, I don't know which test specifically are you talking about, but I showed it to you that what type of question you'll have. You'll have blank type of question in part A of listening, then you'll have multiple choice question in part B listening, and then again you'll have multiple choice question in part C of listening. Then again you'll have blank question in part A of reading, multiple choice question in part B reading, and multiple choice question in part C reading. I hope it is now clear for you. And if anybody has any question, please ask me. Feel free to ask me. I'm here to answer it. Now, okay, if anybody wants to ask, please ask.
So sometime in if I talk about writing, sometimes it's very difficult to identify that which type of letter it has to be written.
Well, yeah, you're absolutely right. Sometimes it is difficult, but most of the times it will already be mentioned in your writing task. It will either say write a referral letter, write a discharge letter, or write a transfer letter. But sometimes it is not given there. Then you can understand the whole scenario, that what you are actually doing to the patient. For example, sometimes it will not be mentioned, but it says that this patient wants to go into a different community and wants to live with his family, or maybe with his daughter, or maybe with his mother. So this patient is completely moving from one community to another one and not coming back, right? And you are not sending this patient for treatment purposes, but you are actually writing to either a community nurse or maybe a community doctor there. Then this whole scenario indicates that this patient is transferring, right? So this is a transfer letter for you. And in other ones, sometimes it will say that you are sending this patient to a different hospital, and this patient will come back to you, or maybe then after that hospital, this patient will go back to their home. Then this is actually a referral letter, right? You are actually referring this patient for treatment purpose to another facility. And this patient will either come back to you or go to their home then. Right? And then in some letters, you'll be writing a letter to someone, and the patient will be going to home maybe tomorrow or after day after tomorrow. Then if the patient is going to their residency where the patient lives, it can either, sometimes we get confused if the patient goes to a nursing home. That is the residency for the patient, right? Then you are actually discharging this patient. Or if this patient goes to their home, then that is also a residency for this patient. Then that is also a discharge letter. So it is extremely important to understand the whole scenario if it is not mentioned in the writing task.
So actually, I have gone through with one case note. The patient name was Susan Matthew. So the case was that she is a community nurse and the patient was hospitalized. Then it's referred to a community nurse for a home visit, and the community nurse was taking care of her. And then she, referring her to her GP. And by saying that she's concerned about her weight loss, her mental status, but during the 3 visits, then nothing, nothing prominent was mentioned.
Well,
I'll surely share a case note.
Well, yeah, you can share that, but without reading that and without reading the whole scenario, it's important to comment about that. But you say that you are actually writing to a community nurse, right?
No, I'm a community nurse. I'm writing to patient GP.
Okay,
Actually, it was a bit confused. Yeah,
okay, and
because
that
firstly, it was admitted to a hospital. Then community means nurse was, was told to take care of her. And the community nurse was noted some changes, and she was a bit concerned about her mental status, her weight, and then she's again, referring her to her GP. But during the visit, where community nurse was taking care of her, nothing prominent was mentioned.
okay.
So that was, I think after reading the case note only you'll be able to help me. I'll surely share it. Maybe I'm unable to make you understand at this point of view.
Well, I got your point a little bit. You ask that you're in that letter, you are a community nurse and you are writing to the patient's GP, right? Uh, Maybe for a treatment purpose, you notice some symptoms of sickness or whatever. You are actually writing to the patient's GP. Is that what you said?
Yes, sir. Yes, absolutely
So
right.
you can share those case notes in a discussion group, and I'll read it and I'll then let you know that what type of letter that is. But if you're sending a patient for treatment purpose, then I would say that is a referral letter. But again, I cannot be 100% sure until and unless I read the whole case notes.
Sure. I will surely, share that case note into discussion group. And thank you so much, sir. Thank you
You're
so much.
welcome. Okay, now coming to the question that we were asked, those who filled the forms, uh, I'll answer them. We have this person, Aisha. Aisha has asked the question about the venue, like how it works, the timer, invigilator, how to fill answer sheet, etc. Other than what I want tips for subtests that must be on our fingertips. Okay, that is a very good question. Now, let me tell you about the venue first. When you go there, everybody is very friendly and they are very professional. They will guide you for each step, what you need to do. They will guide you for everything. To the menu, it is important that you carry your passport and also the email that you receive from them, right? And you can also carry pencils with you. They'll already provide it to you, but if you want to have an extra one with you, you can carry that with you as well. And once they do all the identification and verification, then they will guide you to your seat where you'll sit, and then when the time is over, your test will start. And listening subtest is your first test. And regarding the timer, there will be a watch. uh, you can always look at it during your test, and also your examiner, or I would say your interlocutor, will always announce it that you have, for example, 30 minutes left, you have 20 minutes left, you have 10 minutes left. They will always announce it there. How to fill answer sheet, etc. What you need to do is you need to do it with pencil. And pencil is always good. If you think something is incorrect, you can always erase it and again correct it. So it is always advisable. And tips for subtests that must be on our fingertips. The best tip that I can give you is keep on practicing. Practice. It makes you perfect. The more you do it, the better you become. So always do it and try to follow strategies. Strategies, different people have different strategies. I cannot say that one strategy would fit for everyone. For that reason, we always recommend you to join our course. In that course, we can assess you which strategy fits you the best and which one suits you. So then you can follow that. Then you will be able to, uh, answer the questions correctly. This person has asked, Israr Khan has asked, my question is, what's the fee for OET? How long does OET remain valid once passed, and how to prepare for OET? Well, preparation, you can do it by yourself, and you can attend a course. But when you do it by yourself, it will be difficult because you would need a mentor. You would need to, uh, what you need to do is to have a mentor who can guide you in each step, and will also show you strategies what you need to do it. And regarding the fee, well, it is not always the same, because you'll do payment in dollars, and depends on the currency where you live. If the price of dollar goes up, then obviously it rises there. But currently in Pakistani rupees, I have recently heard that it's 1,05,000, but it daily keeps on changing. So you can always Google it. And regarding the validity, it is valid for 2 years. Okay, next person has asked, I sometimes I cannot pronounce some of the names correctly, so I'm sorry for that, but I'll still try my best. This person, I would say it's uh, Evelyn. Evelyn, she has asked, I don't know if it is she or he, they have asked, I want to understand speaking better. My exam is closed. You can attend our mock tests. You can attend them, and we'll guide you. How is your speaking? You'll understand it. Maybe 1 or 2 mock tests will be enough for you if your exam is closed. Seni, how to pass OET with B grade in first attempt? Well, a good question, and a very simple answer to it. Keep on practicing. Do it on daily basis. For an average person, 30 to 40 days are enough. If you keep on doing it on daily basis, if you can manage to give it 2 to 3 hours, maybe 4 hours on daily basis for OET preparation, then you will be able to pass it on your first attempt. But again, not just preparation is important. Good strategies, good mentorship that you need, that is also extremely important. So, you always need this whole package to pass the OET in first attempt with B grade. Cynthia, questions and answer for the exam. I don't know what does she mean by this question? Questions and answer for the exam. Well, we don't know the question and answer for the exam. You'll only do it once you go to the center and sit for the exam. Then you'll realize what type of questions are there and what sort of answers are there. Khair, we have another person, Khair Khan, materials for OET. Well, materials, they are always available through internet, but I would recommend you not to believe on all of them. Some of them are not, up to the mark. Some of them are not like the real OET. So I would recommend you to join us. We will provide you with authentic material. Hilal Ahmed Qureshi asked, what is OET? OET is an assessment test which they assess your English communication skills through reading, writing, speaking, and listening. Another one, Hafsa Naveed. I have OET in 2 weeks. Can I get prepared for it in this short time? I have already answered this question, and I think it was the person who asked it. Then we have another one, May. The marking system to get score B, and how many correct answers are needed in 42? Well, out of 42, you need to have 30 questions answered correctly. Then you will be able to get 350 score, and 350 is equal to B grade. What OET is all about and how to pass it with ease? Peter has asked this question, what OET is all about and how to pass it with ease? Well, OET is all about English, your English communications, your English skills, and how to pass it with ease. If you keep on practicing on daily basis, maybe for, as I said earlier, for 2 to 3 hours on daily basis, then you can pass it with ease. But again, you need strategies for it. We have another question from Sharma. Tips for listening and reading samples. Well, For reading and listening, I talked about it in the beginning of this session. For listening, you need to have good listening skills. You need to be an attentive listener, an active listener. You need to listen to a lot of contents that are in English language, and you can listen to healthcare related podcasts. And then again, you can listen to English news and try to understand every single word in it. And then you can come to, your OET preparation practice. And as I said earlier, for questions, especially for part B and C, you need to, in listening, you need to underline the keywords. And then when you listen, you can focus on those keywords. You can listen for them. And again, for part B, I talked about it. What you need to do is try to read the question, then go to the paragraph or the text, then come back to your options, and then compare your answer that you found by yourself. Then you can compare it with your options and then choose accordingly. I want to get good score in that. How to get? I think I have answered this question. Listening tricks from Ranjita. I answered it. Regarding writing, well, writing can be tricky sometimes, and for that, you need your writing to be assessed. If I tell you should write like this, you should write like that, no, it will not help you. It may give you a superficial idea, but you need your writing to be assessed by a professional in order to let you know about your mistakes, and also let you know what improvements you can create, and what part should be corrected in which way. So you always need that. So for that, I always recommend you to join the course. So in that course, we can guide you in detail regarding writing. And Mirza Ahmad Ali said everything regarding OET. I have already answered it. What is OET and what are the subtests? I have already answered it. How to prepare for OET exam? I talked about it. Reading tricks, reading detail, pattern. Pattern, I showed it. What is the pattern for OET? Time management in part A and part C, reading, speaking strategies. Well, in speaking, we have a criteria for it, linguistic criteria and clinical criteria. And then each of them has sub parts in it. And, you need to meet all of those parts in it in order to get good score in speaking. So for that, if you want to attend our course, we'll guide you. If you don't want to do that, you can always attend our mock tests. In that, we can let you know about your weak points, weak areas which you can improve. In time management part A, yeah, it is very challenging in part A. Sometimes people have difficulty in it. For part A, I would suggest you, when you are doing the reading, you can read the text in less than 2 minutes. And I would recommend you to do that, because you don't need to waste your time on reading it, because you have only 15 minutes to read all these texts and also answer the questions at the end. So for reading part A, I would recommend you to read the titles and subtitles in the text and maybe the bullets. And if you see any any numeracy there, numerical words there, maybe you see 2, or in other words, I would say, if you see digits in your text, always try to note them. And you can do it quickly. Don't read the paragraph in detail. And also try to name your text. For example, there is a text. In the first text, it says about a disease. Then you can say definition, for example. And text B, it says about the medicine. You can name this text as medication. And then you can name all these texts according to what you have there in it. I'm talking about the contents. And then what you need to do is go to your questions. And I would always recommend you to start from question number 7. And once you read the question and you know that to which text this question is related, for example, the question is related to a definition, then you can go straight away to your first text that you have named as definition and find answer to the question there. So that is what the strategy is. I know it is a little bit superficial. I did not go into detail. That will take a lot of time then. So you can follow this strategy and you can also join us for complete guidance. Okay, Sania Basharat, all details about OET, I have already talked about it. This person said, I took OET 2 times but did not get a required score. I need a perfect practice and need a guidance for desired score. Well, for perfect practice, I can without hesitation tell you that please join our course. And next attempt will be your last attempt. You will definitely pass it. We have brilliant mentors who can guide you in every step, who can make things clear for you, and who can let you know what strategy should be followed and how to answer the questions correctly. So I would definitely recommend you to join our course. Well, this person says, I'm new to OET. I'm not sure if I can pronounce her name. It is Rosemary. I'm new to OET, therefore I need someone to tutor me in all the modules, especially in the tips needed. Well, yeah, we can help you in it. You can join us. We have not only one mentor, we have different mentors who can guide you, and they can guide you the best they can, and hopefully you'll pass it on your first attempt. What to know perfect? How can I cover? How can I improve my listening, speaking? Well, you can improve your listening by listening to different materials online. Go to YouTube, search for different podcasts, and you can listen to other materials as well. Maybe listen to BBC News that is in English, so that will improve your listening skills. This person says, I need material. Well, our team can provide you with material. You can talk to them, they will guide you in detail. This person has asked, what is the best study duration for OET exam preparation? Well, I have said that for an average person, it takes like 30 to 40 days. Some people take less than that, some people take more than that. But again, it depends on how much time you give to OET preparation on daily basis. For example, if you manage to give it 3 to 4 hours or maybe 2 to 3 hours, then you can do it in 30 to 40 days. So I have answered all the questions. If you guys have any question, please ask me. I'm here to answer them. If anybody has any question, please ask me. I'm here to answer your queries. Well, this person has said, Fatihur Rahman, how much attempts can a person do? How many attempts? Okay, well, there is no such limit. You can always attempt it, and you know, you can attempt as many times as you want. Well, what about a petition about reduce the score at C? Sir, NMC will reduce the score at C. Well, we cannot say that for sure. They have, they have already attended that meeting, and we are not sure about that. But hopefully they will do. But I'm not confident. Uh, but you should not wait for that. You should always aim for B grade, and just exclude that thing. Don't worry about what they will do. Just try your best. Okay. If you guys have any question, please ask me. I'm here to answer your queries. And also, I would recommend you all to please join our course for getting good grades on OET. My team members will get in touch with you. They will guide you for each step. And you can join our course. We have brilliant mentors who can guide you regarding all the subtests. And we have 100% pass ratio. We don't have any student who has not passed it yet so far, and all of them have passed it. So please join our course, and we can help you on it, and you will get your desired score as well. Well, this person has said, I'm practicing since last 2 months, but still I'm insecure regarding test. Should we get appear or not? Well, nobody feel confident when they are doing preparation. Always, everybody feels the same. But if you can manage to score over 30, then I would definitely recommend you to go for it. Okay, I'll wait for the candidates. If they have any question, I'm waiting for it. If you have any ambiguity, you're not clear about a certain point regarding OET, I'm here to answer your queries. Please ask me. And please also let me know if this session has helped you in any way. Did it make things clear for you? Did you have some query previously, and after attending this session now it is clear? Please also let me know about that. And how many professionals do you have in this session? Do we have any nurse in this session? If we have, just raise your hand. Okay, we have only one nurse. And how many doctors do we have in this session? Okay, I'll wait for your questions. Please ask me. I'm here to answer them. Just don't feel shy. Just ask me and I'll answer it.
I would like to thank you, sir, and your whole team for this beautiful session. I really appreciate, sir. I'm overwhelmed. Thank you so much.
Thank you so much for your kind words, and we are glad that we could help you in any way, and that is what we are here for. We try to help as much as possible. So thank you so much for your kind words.
Thank you. Thank you so much. May God bless you all.
You can also ask questions in the chat section. If you don't want to unmute, you can ask in the chat section as well. So I think you guys have no question. Then we will just end this session. Thank you so much for attending it, and thank you for your participation. And I wish you all the best. I wish you success in your OET journey, and I hope you all will pass it on your next attempt, whether it is your first attempt or your second attempt. I hope and pray that you all will pass it. And if you have any query, you can always reach our team, and they are always there to help you. And if you have any suggestion for us, or if you have any ambiguity, any question, you can always ask us. So thank you so much, guys.